part two of our Safe Infant Sleep sort of series, mini series, you could say. Um, and so in part one, I talked about SIDS and also about ASSB, which is asphyxiation, suffocation, and strangulation. So it's accidental suffocation and strangulation in bed. And then SUID, which stands for sudden unexpected infant death. And to be honest, this is very important, this delineation between the different acronyms, because all three of those, so SIDS, ASSB, and SUID, all get lumped into SIDS, into the category of SIDS. And so and this is unfortunately what is happening in the research as well. And so sometimes when you see research studies, those numbers are actually higher, even though they are still quite low. Those numbers are higher than if we were to separate each of these three into separate categories. But that's just not happening in the research. They get lumped all under SIDS. So, of course, we want to be sure that we are practicing safe sleep environments for our babies, whether that is bed sharing, whether that is in a separate crib, whether that is in a separate room, whether that is room sharing with you. And we'll talk about the different sleep locations and how all of those can potentially be safe, and also how all of those can potentially have some risks. We'll talk about that in part three. So for today, I want to talk a little bit about some of the risk factors that can contribute to specifically ASSB, so the accidental suffocation or strangulation in bed, and also the SUID, sudden unexpected infant death. Of course, these same risk factors are also going to be at play potentially in sudden infant death syndrome, which is SIDS. However, remember that SIDS has three sort of factors that often need to come together. And one of those factors is vulnerability to respiratory sort of breathing thing at birth. And so that's not something that we can necessarily prevent or manage as easily. Okay, so yes, unsafe sleep environments are largely preventable. And if we can just really be mindful of making sure our babies have safe sleep environments, and that we are educating, and that is sort of what I'm trying to do here, is educate and provide some education so that you don't have to be scared about it. You can just be prepared. And I always recommend that you are really looking at all the different areas that you might potentially fall asleep with your baby in, and make sure that they are as safe as can be. Because what happens is that parents are so scared, for example, of bed sharing. And they're so scared of falling asleep in bed that they actually move to the couch or, a sofa or an armchair or something like that. And they end up falling asleep with their babies there. And that is a lot more unsafe than if you were to fall asleep in your bed with your baby. This is why I really want to make sure that you're thinking about even setting up your bed for safe bed sharing as much as possible, even if you have no intention of ever sleeping in the same bed as your baby. Because there's going to be those 2:00 in the morning feeds where you're just exhausted and you fall asleep. And 100% it is going to be safer if you have set up that situation for safe sleep. Much safer than falling asleep in an armchair or a couch where your baby could roll into the crack and potentially have that accidental suffocation or strangulation in bed, so that ASSB, or the sudden unexpected infant death, okay? So I also want to just mention that, many babies die from blankets covering their heads or pillows, sleeping on a couch, like I mentioned, and becoming entrapped. And then I think in part one, I also mentioned that intoxicated caregivers, so whether it's sedative medications, whether it's alcohol, whether it is recreational drugs or whatnot, can all impact this accidental suffocation, strangulation, sudden unexpected death. Okay. Also, many sleep products that are made for cribs and adult beds are not necessarily designed with infant sleep safety in mind and can cause suffocation or strangulation. So, this is why we really need to be proactive and create safe sleep environments to minimize the risks of ASSB and SUID, and of course, as a result, SIDS as well. But we don't have to fearmonger parents into this, okay? And so, some of the risk factors that have been determined by the American Academy of Pediatrics, um, for all three of those kind of categories of infant death include being placed face down for sleep, especially when your babies are little. So I'm talking like before 4, 5, 6 months, when they cannot turn their heads very well, when they don't have the strength to push up, when they're not rolling themselves over. Being placed face down for sleep is one of the risk factors. Use of soft bedding, so comforters, blankets, pillows, crib bumpers, where your baby's head is. And this is why crib bumpers are one of those things that are not recommended anymore. Because if your baby goes right against the crib bumper, if they get stuck somehow and they can't necessarily breathe through that, and they can't necessarily move themselves away. Maternal smoking or drinking during pregnancy is another risk factor. Exposure to secondhand smoke is another risk factor. Overheating while sleeping is another risk factor. And we can talk about this a little bit more, but I really hate those fleece sleepers and fleece sleep sacks, because fleece does not breathe very well. I would much prefer you put your baby into cotton and that has, or even like wool, which has more breathability, so that your baby can regulate their body temperature a little bit more than these sort of synthetic fabrics like fleece and polyester and those kinds of things. Another risk factor is poor or no prenatal care, and also premature birth or having extremely low birth weight. Okay. So those are 1, 2, 3, 4, 5, 6, 7 risk factors right there. Okay. And I want to talk now a little bit about, common sense says, okay, if we can minimize those risk factors, then we're going to be already setting us up for safe sleep for our babies, right? And so some of the guidelines from the American Pediatric Society, Government of Canada, Canadian Pediatric Society, American Association of Pediatrics, a lot of their sort of practical strategies or tips to help reduce these risks include things like always put your baby on their back to sleep. So that's the whole underlying purpose of the Back to Sleep campaign. They do recommend not to put on their bellies or on their side. I will say that when I had my first child, and of course here I actually gave birth in the United States in New York City. But of course we were told to put our baby back to sleep. And at the same time, or shortly after, my sister-in-law had her baby in Estonia, and they were told to put their baby on their side and to switch sides each night. So it's also, we have to just take things with a grain of salt, because really our society is one of the ones that is so rigid in terms of, and I mean like North American society, in terms of fear-mongering parents into thinking that bed sharing is unsafe, and also putting fear in that we're going to like somehow suffocate our babies. And so we do want to be aware of these. And so you do want to practice safe sleep as much as you can. So yes, put your baby back to sleep if you are living in North America, where that is the current guideline. If you are in a different country, follow their guidelines, please. Also, another question I get from mamas all the time is, what happens when my baby rolls over onto their stomach? I put them back to sleep and they immediately roll over. What do I do? And this is the situation where you can actually trust your baby and allow them to sleep in a position that is comfortable for them. You're not going to be fighting your baby to keep them on their back, right? If you put them on their back and they roll over, even if they roll over in the middle of the night, you're going to sort of monitor the situation, of course, and you are going to see, oh, my baby has the strength to roll over from back to tummy, and also has the strength to move their head, and has the strength to potentially roll over from tummy to back. I do recommend that you definitely start practicing rolling tummy to back. That often comes later. especially in the middle of the night. So we want to practice a lot during the day so that when your baby initially does roll over from back to tummy at like during sleep, and then they're like, "Whoa, I need help. I'm stuck because I can't remember how to roll back." That starts to become sort of more motor memory. And we'll talk about rolling in another video. Okay. And so once your baby does start to roll back to front and front to back, then it's totally fine to allow them to continue sleeping that way. So you don't have to be fighting them to keep them on their back. However, I do recommend that you follow these next steps that I'm going to mention here as well. Okay. Never use soft bedding or, any soft pillows or anything like that where your baby sleeps. So pillows, blankets, sheepskin, stuffed animals, like all of the stuffed animals or crib bumper. This applies for co-sleeping, so sleeping in the same room. It applies for crib sleeping, and it also applies for bed sharing. Now, I will say that I actually really like the recommendation of having a lovey. And from my occupational therapy days, that is a really great thing if it is a small toy. And by lovey, I mean like, maybe you have like a small little blanket, or you have one of those blankets that has the head on and then the blanket underneath, right? Those are not going to be big enough to suffocate your baby, especially if your baby is old enough, they're already rolling, they're using their hands well, they can throw that around. That is not going to be a huge risk factor once your baby is old enough to be moving that around. I do not recommend having lots and lots of stuffed animals in your bed because those can be potential suffocation risks. However, if your baby is old enough, so I would say like, over like the 9-month range, it's nothing to worry about. It's common sense, right? Of course, if you have other risk factors for your baby, then you're going to use your common sense. You're going to make an informed choice that is best for your baby. You also want baby to be on a firm surface. So you don't want to have any soft padding underneath your baby. So like no quilts under the crib mattress or like under the sheets or anything like that. You don't really want to put any baby blankets, like rolled up baby blankets under the sheets either. And you don't really want to let baby be sleeping propped up on a nursing pillow either. And this is something that's important because oftentimes babies with reflux, we think that propping them up is going to be helpful. And it's not really considered safe sleep. Again, I mentioned never sleep with your baby on a chair or a couch. This happens more than you think. Never allow your child to sleep where there could be anything covering their face, which we've kind of talked about. And that leads to the rebreathing of exhaled air. That includes sort of blankets, like big hats that might be flopping in their face, or toys that might be flopping in their face, loose swaddling, sleep positioners we've talked about as well. Make sure baby isn't too hot. So a good guideline to follow is that one layer more than what you might be wearing to bed. If your baby has flushed cheeks or hot ears or sweating, then they're likely too hot. When in doubt, cool is better than warm. Breastfeeding is another way to reduce those risk factors, especially if you're exclusively breastfeeding. This is enormously beneficial and will also help to reduce SIDS as well. Co-sleeping or room sharing for the first 6 months at least is going to decrease the risk. Obviously, you want to make sure that there's no dangling cords or ropes from curtains or electrical cords or camera or phone cables like from your monitor or anything like that. That can pose a strangulation risk. We also don't want to use car seats for sleeping because car seats are not actually safe sleep spaces unless you are in a moving car, especially for very young or preterm babies because it really puts them in a crunched position and they can't actually breathe. So if your baby falls asleep in the car and you bring the car seat in, I would take your baby out of the car seat and either hold them for the rest of their nap or whatever, or put them down in their safe sleep space. You also really want to make sure that you're checking your crib or your bassinet and making sure that there hasn't been any recalls on them or that it has been properly assembled. So that is it for me today. I really don't want to have these videos too long, and this one's getting a little bit on the long side. But now you know some of the risk factors and also tips to reduce those risks. And stay tuned because we're going to talk about all the different sleep locations and how to make them safe in part 3. Bye for now.